In Laboratory 9, we're looking at muscles of the hip and knee joints. So like we did with the arm muscles, we're going to go over some bony landmarks, have a look at our bones to remember the ones that we've learned and also extend on that knowledge. And remember, these bony landmarks that we're learning on each bone will end up being an origin and insertion for muscles that we will learn. So we'll start with that. We'll go through bony landmarks, then we'll look at muscles essentially going from the top of the leg in a downwards direction. Remembering that with the muscles of the hip and knee joints, a lot of them are two joint muscles, so they might appear in more than one table in your lab book. Remembering they're broken up into joint actions in your tables, and when we teach them, we'll often just teach them in an easy way to remember, so they may get jumbled up a little bit. So when we're thinking about actions, remembering fibre directions is really important here. So if we're looking at the fibre directions and they've got to cross that part of the joint, our muscles on the front compartment across the hip joint running up and down in this type of direction will be our flexor muscles. So you'll notice each of these muscles here in some way would be involved in flexion of the hip because they cross the hip joint in front. Therefore, if they were to contract, the leg would move, or hip would flex, leg would move forward like that. Similarly, the ones on the outside play a role in abduction. The ones tracking down the inside would play a role in adduction. Same occurring at the knee. If we cross the knee joint, the ones on the front would extend the knee, and the ones on the back in some way would flex the knee. So really helpful to have a look at the fibres, the way they're tracking, where they're coming from, will help indicate the actions that they have. And remembering that the ball and socket joint up here of the hip means there's going to be some external internal rotation muscles there occurring as well. So we're looking for muscles that might wrap around in some way to handle external or medial rotation.
So here we're looking at a coxal bone. Revising on the landmarks that we already know and the regions, the top part would be the ilium, the back portion would be the ischium, and the front portion would be the pubis. We already know the acetabulum is the socket, if you like, where the hip joint articulates. We've got the ischial tuberosity, remembering the ischial spine. A couple we're going to add on today are these four landmarks here, at both the front and the back of a coxal bone. This is called the anterior superior iliac spine. So to say that, anterior meaning the front, superior meaning high, iliac spine. This would be the anterior inferior iliac spine. So anterior superior iliac spine, anterior inferior iliac spine. Similarly, at the back, we've got the posterior superior iliac spine and the posterior inferior iliac spine. So all we've really said there is front top, front bottom, back top, and back bottom. And these, particularly these first two at the front here, become origins for some landmarks of the muscles of the leg that we're about to go through. Have a look at the femur. Remembering we've got the head of the femur with the neck. We've got the greater and lesser trochanters. And we see when we look at it from the back view here, we can see that ridge across the back. We've got this line now, adding this onto our list, this line that goes down the back of our femur. That's called the linea aspera, and that's going to be an insertion for some of our muscles that we're about to go through. When we look at the bottom, we've got the two condyles, both the medial being that little bit bigger and the lateral condyle with that surface. And the epicondyles, which are the lumps on the outsides of those condyles. So the medial condyle would be this whole lump, and the medial epicondyle would be this lump on the lump, if you like. Again, the lateral condyle would be the whole lump, and the epicondyle would be just that lump on the outside of that whole lump. When we look at a tibia, we've got the tibial tuberosity on the front, that lump on the front there, with the medial malleolus being that inside ankle bone sticking out on the side. When we're looking, so that helps us with the medial lateral, but when we look at this side, the medial side would be the whole lump. The entire area of the tibia would be the tibial condyle, medial tibial condyle, and on the other side, the lateral tibial condyle.
So in this model here, we've removed the abdominals so we can get a better look at what's happening deep inside to see our iliopsoas muscle. So iliopsoas is made up of two muscles, the iliacus, which you can see here, connecting from the ilium and the sacrum, connects with the psoas major, which is this muscle here, attaching right up to the lumbar vertebrae. These two muscles converge together and insert into the lesser trochanter of our femur. Now, they're a very powerful, deep muscle that is responsible primarily for flexion of the hip. So psoas major and then iliacus come together to cross the hip joint, creating hip flexion, connecting to the lesser trochanter. And you'll notice as well how this psoas major portion connects right up to the lumbar vertebrae. So people that have really tight hip flexors, or this muscle is tight, can often pull yourself into that lordosis, pulling the vertebrae forward. So that might explain as well why tight hip flexors are often used in the treatment of lordosis type conditions. So the iliopsoas we just talked about, we can see it here on the leg. We've got the two parts of it, the iliacus, you can see the inside of that coxal bone around the ilium. And then we see this part here is the psoas major portion of that iliopsoas. And we only see a short portion of it in the leg because the majority of that muscle, as we saw before, was up in that trunk area. So the iliopsoas, iliacus and psoas major, together forming the iliopsoas, is the agonist of hip flexion, or our main hip flexor muscle. So when looking at the front compartment of the upper leg or thigh, we've got the quadricep muscle group, which consists of 4 individual muscles. The first is called the rectus femoris. It's a 2-joint muscle that goes from a part of the coxal bone and down, connecting below the knee. On the outside of that, you've got the vastus lateralis. On the inside of that, you've got the vastus medialis, and underneath that, you've got the vastus intermedius. So these 4 quadriceps muscles make up the quadricep muscle group. They all have a common origin. As I mentioned before, below the knee, for this one here, they're actually all connected to the tibial tuberosity, which is that landmark right that we've gone through many times before on the top front part of the tibia. So 4 muscles make up the quadriceps: rectus femoris, vastus lateralis, vastus medialis, and then underneath the rectus femoris, the vastus intermedius. One of them being a 2-joint muscle means it crosses both the hip and the knee, but the other 3 only extend the knee, meaning they only cross that knee joint. They don't operate anything at the hip. On the back of the leg, we've got the hamstring muscle group. The hamstrings consist of 3 muscles: the biceps femoris, this one on its own, and then there's one on top of the other here called the semimembranosus and semitendinosus. The way to remember that is the tendinosus. We've got that T in there, semitendinosus, T for top. So 3 muscles make up the hamstring muscle group: the biceps femoris, semimembranosus, and semitendinosus. Turning it side on, we can actually see the semimembranosus on both sides. It's the exact same muscle traveling up underneath the semitendinosus. I mentioned they're all 2-joint muscles, which means they have an action at the hip, attaching to that ischial tuberosity, so that landmark on the ischium that we've gone through many times, and then crossing over the knee to connect below onto the tibias, the tibia and or fibula below. On the inside of our leg, we've got these 3 muscles converging into this common tendon. This common tendon has a name called the pes anserinus, and it gets this name from the goose's foot. Pes anserinus essentially means goose's foot, which is like a 3-pronged, imagine that being like a goose's foot, a 3-pronged attachment. On the front, we've got the sartorius connecting into the pes anserinus. In the middle, we've got the gracilis connecting into the pes anserinus. And then on the back, we've got the semitendinosus, which was one of those hamstrings we went through before, which connects into this pes anserinus. There's a little rhyme to help us remember the order and which muscle tendons go into it, which is say grace before T. And the first letter representing one of these muscles in some way. So say grace, the say is the sartorius, the grace is the gracilis, and before T represents the semitendinosus. So that helps us remember which muscles go into the pes anserinus and the order from the front of the leg to the back. This sartorius is an interesting muscle, often referred to as the Taylor's muscle. It's the longest muscle in the leg. It's called the Taylor's muscle because it's got a unique series of actions which involves flexion at the hip, flexion at the knee because it wraps it around. So that's unusual in itself. So it's both flexing the hip and knee, and they're on opposite sides of the leg in order to do that. So it's a wrapping. A little bit of lateral rotation and abduction. So
if you sat there with, say, one foot on the other knee, sitting like almost cross-legged like, that's actually the sartorius in action there. So flexing, laterally rotating with a bit of abduction. And that's why they call it the tailor's muscle, because tailors used to sit in this position. Now, on the outside of the leg, we've got this very long tendon, or this piece of connective tissue. This is called the iliotibial band or tract. It's a common insertion like we saw on the other side, but this one here, you might even be able to feel it, or it's a very common injury in a lot of runners, this iliotibial band. It's this tendon running down the outside. It's a common insertion for both the tensor fascia latae, which is this muscle here in that corner of your hip. TFL, you might have heard it referred to. I often refer to it as the coffee muscle because of that word latae in there, but tensor fascia latae connects into the iliotibial band or tract. And at the back, you've got the gluteus maximus connecting into the iliotibial band or tract. Underneath the gluteus maximus, you can see if I remove that, underneath the gluteus maximus, you've got the gluteus medius. So I'm pointing at both that and that because it's running underneath this tendon here. So all of this is representative of the gluteus medius. So the gluteus medius, and directly underneath that, and we don't see a clear picture of that here because it's directly underneath and we can't take it off, but you've got the gluteus minimus having the exact same shape but directly underneath the medius. So gluteus maximus was on the back of the leg, so extending the hip and also wrapping around like this, so it'll play a role in lateral rotation as well. But the gluteus medius and minimus are more so on the side of the leg rather than the back. So they're playing a role in abduction and also medial rotation. So some quite, even though they've got similar names, different actions between the gluteus maximus and the medius and minimus. We've got the piriformis, which is this muscle here deep underneath the gluteus maximus as well, playing a role in external rotation. And then when we flip over to the inside, we've already done a lot of these muscles on the inside with the pes anserinus, but to fill in some of the ones we missed, we've got these adductor muscles. The longer one being the adductor longus, and the shorter one that we can see there being the adductor brevis. Both of them connecting into that linea aspera, which was that landmark stripe down the back of the femur.
So we've just learned a whole pile of new muscles there in the upper part of the leg, and there's a lot to remember. As always, we're using the fibre directions to help indicate what those actions are. So remembering it's got to cross that joint in the direction that it travels, and the fibre directions, whether it's straight up and down or on angles, will give us ideas to whether there's some rotation involved or whether it's just straight up flexion, extension, abduction or adduction. Remembering also, probably the hardest thing to remember with all of this is the origin insertions. There's a lot of them, so grouping them together where possible, so a lot of them are the same, will help us remember at least groups of muscles may have the same origin and insertion, and really cut down on the amount we have to remember there. So they're the key take-home messages. Next week we're doing the lower leg, and that's it. So in Laboratory 10, we're looking at muscles of the ankle and foot. Now, it's a shorter lab today because it's quite simply there's a lot less muscles to learn in the lower part of the leg and bony landmarks compared to all those other areas in the body. So we've just got that lower part of the body to go, that lower part of the leg, learning the actions, origins, insertions as usual, and then really putting everything together so we've got a holistic understanding of the body. So as we've seen before, fibre direction and what side of the joint is key here. So the ones, we're really just talking about the ankle here. Ankle really just dorsiflexing, plantar flexing, which is the majority of these muscles. Some are involved in the inversion and eversion of the foot. But remembering the ones that track down the front will be involved in the dorsiflexion. The ones down the back will be involved in the plantar flexion. Because if they contract, the ankle will go in that pointed type direction. Anything on the side here will typically involved in some kind of eversion, and on the inside or tracking down through the inside will be in some way involved in the inversion.
So before we learn the muscles of the lower leg, we'll have a look again at the bone. So remembering this here is the tibia. We can see that's really easy to see the tibia, this shin if you like, as we run our finger down it. The fibula is a lot more difficult to see. We can only really see this deep part here because it's covered in a lot more muscle. So when we're talking about the muscles, the fibula is deeper, more difficult to see, but you can see the lateral malleolus popping out here. Differences from the arm or the forearm that we might be used to is the ones on the front would be like extensors in some way, because extending the toes is displaying the toes, and the flexors would be on the back, because as we claw our toes down, the flexors are going to do that. They're going to have to be on the back compartment. So a little bit different in that respect to the forearm, but there's a lot of similarities as well. So we'll start using our tibia as our reference. We've got the tibialis anterior, which is this major muscle of our lower leg, responsible largely for dorsiflexion of the ankle because it is on the front. Tibialis anterior, meaning in front of the tibia. Two muscles to the lateral side of that are the extensor digitorum longus, which is extending our digits of our foot, so they would splay the toes. And we already had an extensor digitorum in the forearm, but this is the extensor digitorum longus. So we add that on. Obviously, you can't have two muscles with the same name, and this is longer being in the leg than the one in the forearm. So extensor digitorum longus, extending the digits, and extensor hallucis longus. We see just a slither of it under here because it's running deep underneath this muscle, extending the hallucis. Remembering the word hallucis is the name, or hallux is the name for our big toe. So like our pollex muscles were deep, our hallux muscles are also deep. So extensor hallucis longus. So tibialis anterior, extensor digitorum longus, and then extensor hallucis longus deep to the big toe there. As we rotate to the lateral side of the leg, I've got two muscles, one on top of the other. So we've got the fibularis longus on the top here, and the fibularis brevis beneath it here. It looks very much like the one muscle, but if we look closely at that fiber direction up here, it's running up and down, whereas here they're running sort of side into a common tendon in the middle. But this tendon here is the base of the fibularis longus, and it's called fibularis longus because this really long tendon which actually crosses over under, and that actually crosses underneath the foot and goes all the way to the big toe. So we're looking at the lateral side here, but it's connecting to underneath that first metatarsal. So it's quite a long tendon. So fibularis longus with a really long tendon, and then fibularis brevis with just a really short tendon that's ending here on the fifth metatarsal. So long and short. As we rotate to the back compartment of our leg, we start off with our calf muscle group. Really, it's made up by two major muscles, being the gastrocnemius, which are these two big muscle bellies we see on the back. Gastrocnemius, which when we think about our calves and people, you see someone who goes, oh, they've got nice calves, that kind of thing. What we're really talking about is this part of the calf muscle, these two big muscle bellies. But underneath that, there's a much deeper and often larger muscle called the soleus. Soleus is often called the fish muscle because of its appearance like a fish, especially if we give it a jiggle and fish type appearance. It does look fish-like. Deep underneath that, we've got the tibialis posterior, right? So it's really deep. We can only see a little snippet of it here as it travels down deep to the muscles on the posterior side of the tibia, leaving us with two remaining muscles. Now these two, they kind of flip over each other, giving them a little bit of a different way of remembering them. We often remember these because they are different in that they flip. But the one down the big toe side of the hallux is actually going to all the digits. And the one down the middle, which is in line with the digits, is actually going to the big toe. So there's a flip taking place down here between these two muscles. So as they both flex, the one on this big toe side is called the flexor digitorum longus. So it travels down this side of the leg and then crosses under to all the digits. So flexor digitorum longus. And then the one traveling down the middle that flips over and then goes to the hallux is called the flexor hallucis longus. Now, if we're looking at some of the actions of these muscles, there's a lot more muscles that plantarflex than there are dorsiflex. Because we look at our lateral malleolus as the pivot point, everything coming behind is going to play a role in plantar flexion. So even these side muscles here, your fibularis muscles, they travel behind that lateral malleolus, which means when they activate, this will go into plantar flexion at the ankle, leaving only the ones we discussed on the front being the dorsiflex related muscles.
So that's it for muscles of the ankle and foot. It's a lot shorter, that lab, because there's just simply less muscles to know in that area of the body. However, this gives us a lot more time to go over the origins, insertions and actions for all the muscles we've learned in previous weeks. There's a whole lot there that we've got to really revise in preparation for our final exams. Is that it? We're done? I just made all that up. I hope it sounded right. Yeah?